Well, hello. Welcome to today's webinar hosted by the Association of Food and Drug Officials. My name is Jerry Voitala, and I'm the Executive Director of IFPTI. Thank you for joining us today for today's webinar highlighting IFPTI Fellowship in Food Protection Cohort 8 Fellows as they present their research projects over 3 Fridays in July. These presentations are the culmination of a unique year-long leadership program funded under a cooperative agreement by the FDA Office of Training, Education, and Development. Today we will experience 3 project presentations. As for the format, the fellows have been given strict requirements to consolidate their presentation of their project into a 10-minute segment followed by questions from the audience. If you would like to ask a question while the fellow is presenting, go to the bottom of your Zoom screen and type your question in the Q&A box. Now, we may not get to all of your questions in the interest of time, so feel free to contact the fellow by email or contact IFPTI if you would like to learn more. So at this point, let's get right into it. Let's begin with Summer Williams. Summer, would you like to start us off?
Yeah, sounds great. Thank you everyone for joining us today. Alrighty. So my name is Summer Williams, and I'm the Emergency Response Coordinator with the Florida Department of Agriculture and Consumer Services. And today I'm going to share with you my research on specialized tools used by state food protection regulatory agencies during the response to natural disasters. But first, I'm going to play you a short video clip of the devastation of Hurricane Michael on Florida's Panhandle in 2018. Natural disasters can happen anywhere in the United States, whether it's a flood, a hurricane, a tornado, a blizzard, or wildfire. This picture actually happens to be a retail food establishment after a flooding event in Michigan in 2018. So after a natural disaster, many state food protection regulatory agencies send teams out to assess the damage of the food supply. The last thing we need after a natural disaster are people getting foodborne illness. So there's a lot of questions that we need to ask after a natural disaster. Are there power outages? Are there effects from flooding or wind damage? Is waste disposal going to become an issue after a natural disaster? As you can see, this dumpster pictured here, it's open at the top, so it can, you can get rodents or pests with this open dumpster. What about adulterated products not secured and vulnerable to dumpster divers? Since 2016, Florida has activated for 4 hurricanes. The use of specialized tools are vital items used to assist with response efforts rapidly. Examples of specialized tools used during the response include things like GIS mapping, Strike Team Go kits, or something just as simple as an assessment checklist. Specialized tools can even include ways of communication such as alert notification systems. In Florida, we're always looking for a cost-effective solution to communicate when cell phone towers are down. So this brings me to my problem statement. My problem statement is as follows. Specialized tools that can benefit state food protection regulatory agencies during response to natural disasters may not be commonly known. Here are my 3 research questions. 1, what types of natural disasters have resulted in response from state food protection agencies? 2, What specialized tools do state food protection agencies use in response to natural disasters? And 3, what costs are incurred for these specialized tools? For my methodology, I utilized SurveyMonkey to create my survey, and it was distributed using email lists from the Directory of State and Local Officials. In this picture on this slide, this is actually Hurricane Irma in 2017. She was so large, she covered the entire state of Florida, and she prompted 6.5 million residents to evacuate their homes. I chose to survey state food protection agencies on what types of natural disasters they may have exercised for or responded to in the past 5 years. In addition, I surveyed what types of specialized tools they use in their response efforts. In this picture, you see it's a map. It's from NOAA, and it depicts billion-dollar weather and climate disasters in the United States in 2018. You can see from coast to coast, there's things like fires, droughts, blizzards, tornadoes, hurricanes, and so on. Results were received from 38 state food protection agencies. All but one of these respondents have exercised or responded to a natural disaster in the past 5 years, and the most common was flooding. The photo you see here is the aftermath of Hurricane Michael that you saw in the video earlier. This is a retail food establishment, and it was completely destroyed. 97% of respondents utilized the Incident Command System. The Incident Command System, also known as ICS, is a management system designed to enable efficiency by integrating equipment, personnel, and communications operating within a common organizational structure. 73% of respondents utilized GIS mapping systems, with 11 of the respondents reporting the use of the popular ArcGIS mapping software. 68% of respondents reported utilizing communication tools other than phone or email, with radio systems and social media being the most common tools. As we all know, social media is a great no-cost tool to get messages out to the masses during a natural disaster, but it can also serve as a tool to gather information from the public with platforms such as Twitter or Snapchat. So what if cell phone towers are down? How do you communicate? You can't communicate through phone, email, or social media. So that's when radio systems come in, such as walkie-talkies or the use of a satellite phone. 34% of respondents have a Go kit for response, but many of the states stated that they did not have kits specifically made for natural disaster response. And in this picture, this is actually a Go kit from the Florida response team. We stock ours with first aid kits, gloves, ponchos, bug spray, and sunscreen, alcohol swabs, stop sale tags, and paper forms such as boil water notice guidelines. We keep these stocked up, and we store them in accessible areas for grab-and-go purposes for our strike teams. Other specialized tools that were reported among the state food protection agencies on the survey included hazard vulnerability assessment tools, enhancements to electronic inspection system capabilities for emergency response tracking, off-grid power sources such as solar and gas generators, and mobile response equipment such as vehicles, trailers, and tents. Less than half of the respondents reported the use of a damage assessment form or guidance documents. This is a snippet of the damage assessment form created by Florida's response team. You can conduct a 20 to 30-minute assessment quickly in the facility after a disaster. The questionnaire is filled out by our strike team members with the facility owner or person in charge. Some of the information gathered on the form include physical damage to the building, contamination to food and/or processing areas, temperature abuse foods due to power outages, and so on. We also use this form to track the total amount of food products destroyed. In conclusion, the most commonly used specialized tool reported in my survey was the use of the incident command system. At essentially no cost to the agency, it just requires training for the users. FEMA offers numerous online courses through their National Incident Management System for no cost on their website. From my results, states are underutilizing social media and alert notification systems. As we discussed, social media is a great no cost effective tool. In addition, no respondents reported inexpensive statewide communication when cell phone towers are down. The only reported communication tool was the use of walkie-talkies, which you can only use short distance, and the use of a satellite phone, which is about $400 per phone. I'm recommending the following. Nationwide outreach about the importance of preparedness for a natural disaster is needed for state food protection agencies. In addition to a checklist developed for go kits for natural disaster response. Also, a damage assessment form specific to food safety would greatly enhance natural disaster response nationwide. All of these things could possibly be completed by a work group or committee within the Association of Food and Drug Officials. Lastly, awareness of this project by the Association of Food and Drug Officials, the Food and Drug Administration, and other relative federal agencies so that information and/or training can be provided to food protection agencies where needed. I'd like to express my gratitude to many people who supported me through this project. First off, to everyone at IFPTI, the staff, and the Cohort 8 fellows. There's no one else I'd rather be with during the COVID cohort than you guys. And a special thanks to Joe Corby. Without his guidance and wisdom, I would not have completed this endeavor. So thank you, Godfather. I would also like to thank my agency leadership at FDAX and my teammates. Thank you for your support and thank you for allowing me the time to work on this project. In addition, I would like to extend my appreciation to Brenda Morris with the Association of Food and Drug Officials. Thank you for your mentorship in the food safety world over the years. And of course, I could not have achieved this project without the survey results from all the states who participated. So thank you very much. Questions?
Okay, thank you very much, Summer. We do have a few questions coming in for you, so I can read the question and let's see what your response is. So first question, as you mentioned, communications are always a challenge during disaster response. Have you been able to identify other effective methods of communication in addition to social media, particularly when cell towers are down?
So really, if cell towers are down, most people don't have internet access. So social media is really hard to get information from if you don't have any sort of internet or Wi-Fi. That was actually the biggest thing that I wanted to accomplish with this project, and it seems that no one really has anything besides, you know, the short distance walkie-talkies and satellite phones, which are super pricey. You know, that alert notification system that I was talking about. I know in Florida we have one, and several other states mentioned it in the survey. It's great, but again, it's like an Amber Alert where it sends a message to your cell phone, and if you don't have service, you don't get it. So unfortunately, I didn't really find anything else besides the stuff that I mentioned.
Okay, good. We have another question here for you. What recommendations for training exist besides, you know, you mentioned FEMA's incident command system training. Are there other things that you could recommend?
Yeah, there's a lot of good trainings out there through the emergency management world. You guys put me on the spot there, but I know LSU has some training through their NCBRT program, and I'm not sure what those acronyms actually mean, except LSU is the college, the University of Louisiana State. But I know that they have some great training specifically to like agro-terrorism and some other natural disaster classes as well. But if you shoot me an email, whoever asked that question, I can share some other things.
Okay, good. Here's another question. I love the to-go kit checklist idea. Did your research poll respondents on what was in different states' kits? That would be a great place to start gathering checklist details.
Yes. I didn't get that detailed when I set up my survey, but I'm glad you asked because I have a little bit of an extra slide on the Go kits. I know I had a photo in my presentation of what Florida's look like. I know Washington and I believe Michigan has shared their Go kit inventory with me as well. I have been asked, how much do they cost? And that obviously can vary depending on what is in the kit. I pulled pricing on the Florida kits. And we have about $75 worth of items in our kits, but that also can vary, for instance, a GPS unit. I know most people use their cell phones for mapping purposes to get around town, but if cell phone towers are down, you're most likely not going to be able to use Google Maps. So a GPS, the old school style that you plug in your charger in your car, that runs off satellite. So they will work when cell phone towers are down. So in Florida, we do keep those on hand. I know it seems kind of old school, but we keep them updated and they do work when cell phone towers are down. So that's something that would go in a kit as well. We keep them in our cars so they don't go specifically in the kits. So I did not include that in the $75 price range on those. But to answer your question, I know that was long-winded, but there are some states that have shared inventory with what is specifically in their kit.
Great, and I'm glad you told us the cost because that's, I think, a question that comes up a lot. Okay, and we have another question for you. How have you seen your equipment caches and forms change with each response? What would you say has changed most dramatically?
That's a great question. In Florida, I would say probably the most changed form that we have. I mean, we're pretty lined up with our boil water notice guidelines, and we have a lot of outreach forms that we hand out when we do our assessments to the facility owners. But one thing that we really didn't think about until it happened was during Hurricane Michael. Just for weeks, no one had any power or any internet, or they were getting information from the radio, basically. So we decided to build an informational form with some information on where people can go and pick up food and water in their local communities and phone numbers that they could call. So that's something we actually, our strike teams got ready real fast, and we made copies and just started handing them out. Other than that, everything that we've had has basically been on point for every hurricane that we've had here in Florida. Of course, now with COVID-19, things have been different, and we're kind of going as with the flow of things and coming up with new forms to hand out to our facilities with that response.
Okay, great. Another question for you. After an emergency response, is there a debriefing held for field staff who utilize the toolkit during the response?
That's a great question. So after any sort of activation or response in any sort of emergency or a planned event, like something with the RNC or DNC, the incident command team holds an after action meeting with the team, whether it be, we usually let them kind of soak in the response after a while and wait a few days, and we do a lessons learned and kind of go through everything. What was great that happened? What do we need to work on for next time? And that has been something that has come up. Hey, it would have been great to have this in our kit. Can we add that for next time? I know in the past we've had people ask to put in toilet paper. I guess you never know when you might need some. Things like that, paper towels, garbage bags. simple things that you don't really think of that would go in something like that.
Okay, good. Another question for you. Did you review the RRT playbook? And if so, did you find any great resources you would recommend that, that our participants check out?
Yeah, the RRT playbook is great for any states that are a part of the Rapid Response Team program. Definitely should go into the RRT playbook and get some of that information. As far as my survey goes, I just surveyed specifically what those states were using. So I did not use that specifically for my research.
Okay, got it. Well, here's an interesting question for you, Summer. And I know this wasn't part of your research, but are you aware of any states having to activate an ICS as a result of COVID-19?
I've talked to some of my friends around the nation, and I know that they've been working um, through COVID mostly through their Department of Health teams. I know, some of the ROTs are housed under the agriculture section, so I guess it really depends on how the states are set up. But I do know several states are activated with the Department of Health teams.
Okay. And let's see. Maybe one last question for you, Summer. What surprised you most from the research results you found from the states?
I'll say it again. I really kind of was surprised that there wasn't a way, a cost-effective way that people are communicating when cell phone towers are down. I know that's like the $1 million question here in Florida. Um, like I said, people use walkie-talkies. That's great, but in Florida, we talk to our staff from Pensacola all the way down to Key West, so that doesn't really work. Satellite phones are great. Again, they're super pricey. So, with state agencies and funding, it's probably not going to work best. Um, so, if anyone knows the answer to that question, hit me up.
Yeah,
Because I'd love
absolutely.
to know. I know it's a struggle.
Yeah. So absolutely, yeah. Feel free, and that's all the time we have for questions for you, Summer. But feel free to contact Summer, or if you need to get a hold of Summer, go through IFPTI, and we'll be happy to pass on some questions to Summer for you, or contact Summer if you just want to chat more. So next, we're going to move to our next presenter, Laura Wilde.
Great, thank you very much. Good morning and good afternoon. It is my pleasure to be here today to share with you the results of my research project. My name is Laura Wilde, and I work with the National Environmental Health Association as the Senior Program Analyst in Food Safety. I present to you today the challenges and practices associated with the implementation and enforcement of cannabis-infused food product regulations. At the time of my research, cannabis had been decriminalized in 11 states and the District of Columbia. 10 states have allowed the sale of recreational edibles to the general public. Federally, cannabis is considered a Schedule I controlled substance, which is defined as a drug that currently has no accepted medical use and has a high potential for abuse. As we know, marijuana has been legalized in multiple states for several years, and in the absence of a federal framework, states have developed unique regulatory requirements for cannabis edibles. This map depicts the 11 states and the district in which marijuana has been decriminalized. Again, 10 of these states allow the sale of recreational edibles to the public outside of a medical marijuana program. Guam and the Northern Mariana Islands have also legalized cannabis for adult use, and regulation development for the cannabis sale is currently underway. My research focused on states that have had recreational edible regulations in place for at least 2 years and comprised of states in the western part of the United States, in which I will discuss in more detail shortly. General concerns with edibles have included inadvertent marketing to children and adolescents, misleading or inadequate labeling, and inconsistencies in THC content within a food product. On the right of the screen are several examples of THC warning labels required by various states. You can see variations in these labels, which is a good example of one of the ways that regulations and requirements vary from state to state. To control for some of the potential hazards of edibles, states enforce regulations on serving sizes and THC homogeneity, labeling and packaging requirements, tracking and storage requirements, waste disposal, and education and training for edibles operators. The specific regulations vary from state to state. This brings me to my problem statement. Multiple states have allowed the sale of cannabis-infused food products for several years. However, challenges associated with the regulation of those products are relatively unknown. These are my 3 research questions. What are the most frequent food safety violations amongst states that have enforced edibles regulations for at least 2 years? What unique food safety challenges have been identified in the implementation and enforcement of edibles regulations? And are there training requirements for edibles processors, and what do they entail? There were 3 phases to my data collection. First, I used the Association of Food and Drug Officials Directory of State and Local Health Officials to identify contacts for the various marijuana programs. Additionally, I used my connections with AFPTO Cannabis Committee and my existing network to identify the key informants for my interviews. I also used the internet to gain a better understanding of the setup of each state to direct my inquiries. In phase 2, I developed a set of interview questions to pose to the key informants during phone interviews. The interview script was tested with coworkers and adjusted as needed prior to initiating the interviews. I designed the questions to obtain both qualitative and quantitative information, and when I conducted the interviews with each state, I indicated that their responses would be anonymous. Each interview was recorded and later transcribed for accuracy. In the final stage of my methodology, I compiled my data using Microsoft Excel. This helped me to display the responses from each state and make comparisons. Much of the information I gathered was qualitative and could be displayed in tables, which you'll see in this presentation. Now, this map depicts the states included in my study. I identified 6 states that had enforced recreational edible regulations for at least 2 years, and I was able to collect data from 5: Alaska, California, Colorado, Oregon, and Washington. I identified subject matter experts, managers, and inspectors in each state and conducted my interviews accordingly. Here are 6 frequent violations that were identified by the states in this study. You may notice that these may not differ greatly from what you might see at a traditional food operation. States identified that some edibles processors had unique extraction equipment and various ways of cleaning and sanitizing. Labeling violations included improper allergen labeling and THC warning statements. I also concluded that some basic food safety concerns, such as bare hand contact with ready-to-eat foods and lack of appropriate food safety equipment like hand washing and warewashing sinks, was a frequent violation. One state indicated that poor record keeping was one of the most frequently cited violations. In this research, I found that a unique requirement for edibles operators is the amount of tracking and documentation that must be kept for tax and legal purposes. There were several unique challenges identified in this study. First was whether the state considered edibles a food or a drug. In some states, an entirely new definition was created for the term edibles, considering edibles to be neither a food or a drug. States did mention that a lack of federal oversight impeded the smooth adoption of recommended standards and rules, and states were really on their own, so to speak, when it came to development and implementation. One state indicated that interstate recalls, despite the legal restrictions on interstate commerce, were challenging. All states in this study had multiple agencies responsible for the regulation of edibles. Therefore, communication was key amongst agencies, as was inspector training, whether the inspectors were from the food safety side or another agency with minimal food safety background. States indicated that operator training in food safety was challenging, as many edibles operators were relatively new to the food safety arena and the regulations associated with safe food production. Laboratory testing inconsistencies was also a significant challenge identified by several states. An interesting comment from one of the interviewees that I would like to highlight was that in the absence of packaging, edibles look the same as traditional food products, unless they're individually stamped with a THC warning. This poses a more broad threat to public health. All states in this study identified that food safety specific operator training was very important. 4 out of 5 states required a certified food protection manager, while the remaining state required demonstration of knowledge of food safety principles during an inspection as the requirement. All 5 states have requirements for operators to attend trainings based on security, taxation, licensing, and tracking, which are all unique to cannabis. I drew several conclusions from this study. First, food items, regardless of THC content, should be treated like food items. The same basic food safety principles can be applied to edibles, with some unique challenges associated with cleaning and sanitizing equipment, labeling, and operator education. Unique equipment can cause confusion on how to clean and sanitize without impacting extracting components. A thorough plan review process that included labeling, review, and approval proved to be of benefit for both the industry and the regulatory agencies prior to products hitting the market. Some states greatly limited the types of food products that could be made into edibles, while other states allowed multiple types of products. The states with the most limiting regulations allowed only non-temperature control for safety food products. Other states had very few restrictions. From the state that had the fewest restrictions, the interviewee indicated that eventually the market became self-limiting after the initial push to create new and innovative products subsided. The sentiment was that it was more cost-effective to create a simple cookie or candy product than an elaborate sauce, both of which provide the user the same desired effects. Food safety education was highlighted throughout the interview process as an important factor in the success of a safe edibles program. And finally, educating inspectors on what to inspect and how to inspect were of value to several states in this study. In conclusion, I would like to recommend that states who are preparing to adopt edible regulations take the following items into consideration. Food safety training for operators is important for the overall safety of all food products, regardless of THC content. Laboratories with accreditations or certifications specifically for edibles testing can help ensure consistency in testing across the state for valid results. Inspectors who are minimally familiar with food safety or who may be unaware of what to expect during an inspection would benefit from training. This training could be offered by the state, a national association, or an edibles industry partner. If an agency is involved with the regulation and has not previously had exposure to food safety requirements, thorough training for those inspectors is recommended. And finally, multiple agencies means multiple lines of communication, and it's very important that the agencies are cohesive and collaborate with each other frequently to ensure a safe food product throughout their state. I would not have successfully completed this project without the support of both my current and past employers. Thank you, Dr. Jajak and Jesse Bliss, for supporting me in this program while onboarding with NEHA, and thank you, Dr. Sharon Lewis, for supporting me in my initial enrollment and participation in the fellowship. And of course, thank you, Jerry Watala and Dr. Camel, for allowing me to maintain my fellowship during my career transition. Thank you to my mentor, Kathy, and the other mentors, Joe, Dan, and Doug, and the entire IFPTI team. Thank you to my fellow fellows, and of course, the interviewees who provided such valuable information for this project. Thank you all for your time today, and I'm happy to answer any questions you may have.
Okay, great job, Laura. Thank you.
Thank you.
We do have a few questions starting to come in, so feel free to type into the Q&A box if you have a question. Here's a question. In the selected states, how many times has cannabis been found in non-cannabis products? And were there complaints of people testing positive from unknowingly consuming cannabis in what was thought to be non-cannabis food products? Does that make sense?
It does. That's a very interesting question, and my research didn't really focus on that.
Yeah.
But I do have the contacts for those states, and I can certainly look into those. I know that a lot of the state websites have areas where you can submit complaints right on their website for products that you're concerned about or products that have hit the market that are not labeled appropriately or that are not inspected and verified. So I can certainly get back to that person with a few more details from the states that I interviewed to respond to that question.
Okay, And then here's another question for you. What processes can operators undergo to produce consistent production of THC contents in edible cannabis products?
This is a wonderful question, and this is actually spurred on my desire to continue my research on cannabis edibles, because there are homogeneity issues in the states identified in this study. An example was given from one of the states that they took a muffin and they wanted to test it for THC content, and they divided the muffin into two parts, and one part tested a completely different THC content than the other part, which brought up a very large concern of how are the edibles operators ensuring the homogeneity and the consistency of the THC throughout the product. So this is certainly a gap that's identified, and there's not a lot at the moment of federal funding for cannabis research. I hope that we are able to get a little bit more funding and have more arenas focus on this area, because I think that the homogeneity specifically for food products that are given to the medical marijuana communities is very important. So I can't really answer the question on the types of processes like mixing or blenderizing. I can't really give information on that because that wasn't part of my research, but it's certainly a gap that was identified by a lot of states. And we as an industry would really benefit from more research being done on the homogeneity of the products and how to achieve it.
Okay, great. Well, here's one about your survey. What did your survey show as to the best standard to train operators about food safety? 21 CFR 117 subpart B GMPs or other industry-based standards?
So the majority of the states I talked to had the same food safety handling requirements as they did for traditional food operators. So that is a certified food protection manager on site during all hours of operation, demonstration of knowledge. I will say that there was one state that said that they partnered with the cannabis industry to provide a training to their inspectors. And I think that partnership is really important because you're taking a emerging food trend that we don't really know a whole lot about in the food safety arena, and you're introducing it to food safety. So the sentiment that I got from the respondents was food is food, the same hand washing and temperature control and employee health, those same requirements still apply. And they can be achieved. I mean, you're making a brownie, you're making a brownie. You're making a muffin, you're making a muffin. So those standards can be applied across the board, whether it's THC or whether it's a non-THC product. But I think that the point that I want to hit home is that partnership with the industry so that we can learn more about the product and maybe the specific food safety or the things that might impact food safety. That's where that connection is. So the collaboration between regulatory and industry, especially with an emerging food trend like this, I think is really important for training.
Great. I was going to jump to another question, but here's one that someone wanted to do a quick follow-up on your discussion about homogeneity. And is there any sense in existing data whether or not homogeneity variations may be intentional on the part of processors? Did anything come across in your research on that?
No, nothing in my research came across like that. I didn't really focus on why homogeneity was a problem, or perhaps what food products had issues moreover with homogeneity in where the THC was settling in the product. That wasn't really part of my research, but certainly a very interesting topic to dive into. Does a specific food product have different factors that contribute to where on the product the THC is, given the chemical composition of the food? So I did not do any research on intentionally dosing a product with more THC in one area than another. That wasn't part of my research, but certainly something very interesting to look into for the future.
Great. Okay. Well, about your research, do you envision a more unified or consistent level of regulatory enforcement for cannabis-infused food products in the future?
That is certainly the hope. When, cannabis has been legalized in states for many years, and as more states come on board, we're really just looking at what previous states have done. And this is it is a good way to identify best practices. And that was part of this research, was that I wanted to have something for future adopters to say, oh, well, we need to partner with the industry and get some training for our operators. And we need to identify who's doing what and what works well in these other states to maybe have that in our state. So obviously a unified and integrated approach is important in any regulatory framework. This creates consistency amongst states and jurisdictions, and it helps with the industry and understanding all of the regulations. So I would hope that, yes, we do have a more solid framework for states to adopt, similar to the food code. Would be very interesting to see if there was something that was consistent that states could look at as best practices and recommendations for them to adopt in their own states. That would be obviously the most ideal goal for cannabis edibles operations in the regulatory realm, yes.
Okay. And then are the states that you dealt with performing any adverse event tracking related to edibles that you're aware of?
I'm not really sure I understand what is meant by adverse events.
I'm guessing maybe along the line of if complaints are received or if there are like illnesses associated perhaps?
So I don't know the answer to that question. I know that the states did struggle with a significant amount of complaints coming in, but they would get complaints about operators selling where they shouldn't be or illegal operators. I did not dive into the medical side or any of the side effects that were happening in the states for people that either knowingly consumed too much or unknowingly consumed edibles. Those are two public health concerns in that when you ingest an edible, depending on the food product, the contents of the ingredients in that food product, how much THC is in there, and how your body metabolizes it, you can often get a delayed high, which encourages people, if they don't feel that immediate reaction as you would feel if you were inhaling, it encourages people to eat more, and there can be what they're calling an overdose in THC, which can cause some pretty not very friendly responses in your body and make you feel not so great. So no, I did not really dive into the medical. I didn't really dive into adverse effects of someone consuming a food product knowingly or unknowingly that had THC in it. But those conversations are happening, and there is a lot of research going on that I could see about testing the different levels of THC and the reactions that laboratory rats and mice are having. So those research projects are underway, and I'm certainly happy to field any questions or make connections with people that have specific questions about that, because I think there's a lot more questions than answers at this point. But all of these questions have been really great and brought up some really great points and gaps, and I'd be happy to make those connections and get answers for people as best as I can.
Mm-hmm. Great, and I know we're getting a lot of questions, Laura, so I'm sure folks, what we'll do, I think, because we get a lot of questions and we're running out of time, is we'll make sure that we put the fellows' email addresses in the Q&A boxes so that we'll not only share the existing questions, but you can ask the fellow directly then by email if you'd like as well. But we only have time now. Well, I think we're just about out of time, Laura, but there's a lot of questions coming in, so there's a lot of interest, but so we apologize we can't get to everyone's, but again, we'll have someone type, oh, there it is. So someone type Laura's email address, and feel free to ask your question of Laura by email. So thank you very much, Laura.
Thank you.
Okay. So now we'll move on to our third presentation. And Joshua Lopez, would you like to take over?
Sure, I'm here. 1 minute, I'll just share my screen here. Okay, this is an IFPTI Fellowship in Food Protection Cohort 8 presentation on cold brew coffee regulations. My name is Joshua Lopez. I'm a food inspector for the New York State Department of Agriculture and Markets. A little bit of background, there's no standard of identity for cold brew coffee. Cold brew implies ambient temperature steeping, usually from 12 to 24 hours, and the market's exploded 580% from 2011 to 2016. There's often no kill step in the process to control pathogens, like a cook step. After the beans are roasted, they're subject to environmental contamination until sealed in the final container. Research into associated hazards has been limited to industry-funded challenge studies thus far, most of which are proprietary. Cornell University's challenge study found Listeria monocytogenes bacteria surviving for up to 3 weeks after inoculation into refrigerated cold brew. E. coli and Salmonella had 5 log reductions after 2 weeks. So based on this, Listeria monocytogenes was considered by Cornell to be the primary pathogen of concern or target organism for cold brew coffee. For an Oregon State challenge study, viable cells of Listeria monocytogenes were found 14 days after inoculation. Salmonella survived 7 days and E. coli lasted 10. One major cold brew coffee recall has been conducted recently by Death Wish Coffee in New York State. They were selling their nitrogen-infused cold brew in hermetically sealed cans labeled "Please keep refrigerated." There was no heat treatment of the product during manufacture. The potential for Clostridium botulinum growth was of concern, as refrigeration was the sole barrier to botulism. CBOT spores were not adequately inhibited or treated. That was the reason for the recall. Botulinum challenge studies have been conducted, but information is mostly not available. It's privately held and safety hasn't been benchmarked. So they need to have food safety documentation for these concerns here. Here's an example of a typical flow for the processing of cold brew. They roast the beans, grind them, steep 18 hours at ambient temperature. There's a filtration step often, possibly around maybe 5 microns, could vary. Dilution, and then they bottle it with nitrogen gas, which makes a reduced oxygen package for sure, and then cold storage of the finished product. So here's some examples from around Brooklyn, just some of my experiences. This is a retail operation, 76 degrees Fahrenheit in the basement of a retail food store, unknown time steeping. Here's some very nice wooden contraptions here. This is another retail operation. And this is the same operation as the last one. And this firm, you could see the bell jars on the bottom left with the screw top lids, likely ROP, same with these jugs and multiple layers of plastic wrap over on the right. These are being shipped around Brooklyn in chilled parcels, also delivered around Brooklyn in chilled parcels with bike couriers. And again, no food safety documentation for any of these places. Here's a larger operation, wholesale and retail. They were blending milk in with this one. Per their own records, the product with the milk had a pH of 6. It's also being shipped out for HPP processing at 7,000 PSI. No validations, no food safety documentation, process reviews, none of the things that you'd like to see to ensure that this is safe. Nitrogen infused. This is what they use to put the nitrogen into the bottles here. There's the tank on the left. Here's the problem statement. Regulatory strategies employed by food safety agencies to ensure food safety of cold brew coffee processors in the United States are unknown. Research questions. What hazards have food regulatory agencies determined to be of concern in cold brew coffee, and how do they determine the hazards? What regulatory policies are in place for cold brew coffee, and how are they enforced? Are there any food regulatory agency plans for potential changes to policies and regulations of cold brew coffee? In methodology, I sent a survey monkey to different food regulatory agencies. Multiple answers were able to be submitted for each question. Results were compiled into graphs. Comments tagged to questions were compiled into lists, and results were analyzed for similarities and trends. Conclusions were drawn from both quantitative and qualitative data. Participants were selected from state, county, municipal, territorial, and tribal food regulatory agencies throughout the United States. Over 1,200 regulators were sent the survey. 167 responses were received. Here are the results. Before I get into this, let me just clarify too. Again, multiple answers were able to be selected for each of these. So these results don't necessarily indicate that it was primarily retail regulators such as departments of health that were the primary respondents, such as the Department of Ag would have selected multiple of these. 88% of respondents indicated retail jurisdiction, 24% wholesale. You can see that there. And also 62% indicated they regulate according to the food code, 16% according to CFR 117, 18% indicated they regulate qualified facilities, and 41% indicated a combination, other, could be unique local codes, things like that. Here's the significant results. 74% of agencies had not determined whether there are any potential hazards associated with cold brew coffee production. For the 26% stating their agency had determined potential hazards, 100% of the supplemental responses did not specifically identify all three significant hazards of Listeria monocytogenes, Clostridium botulinum, and mycotoxins. So I was hoping to have those identified in the supplemental responses. 2 respondents listed the hazard of Listeria monocytogenes, with one listing that only, without the other 2 significant hazards. 8 respondents listed the hazard of Clostridium botulinum, with 7 listing that hazard alone. And 2 respondents listed the hazard of mycotoxins, with 1 listing mycotoxins alone. Another respondent cited mold. They just said mold without listing any other hazards. 94% of respondents indicated their agency has no plans for potential changes to policies or regulations related to cold brew coffee. 94% of respondents indicated the cold brew coffee industry has not brought up any questions or concerns regarding potential hazards with cold brew. The results indicate that food regulatory agencies have a broad understanding that there are potential significant hazards in cold brew coffee production, without clear specifics as to what the potential significant hazards are and the basis for evaluating those as hazards. The FDA Food Code identifies cold brew coffee as a low-acid food requiring a variance for ambient steeping. Without a complete hazard analysis, regulators may have insufficient information upon which to evaluate a variance request. The food regulatory system must continue to transition towards a hazard analysis systems-based approach to be effective in controlling hazards. Research exists that demonstrates the need for control of L-mono, CBOT, and mycotoxins in cold brew coffee, yet it is not listed as a specialized process in the FDA Food Code. Few regulatory agencies are looking into potential necessary changes to regulatory approach, and industry has not been active in reaching out to food regulators. Here's the recommendation section. Cold brew coffee should be identified as a specialized process in the FDA Food Code. Further publicly available challenge studies are needed. Food regulatory agencies should develop specific policies towards their inspections of cold brew coffee. FDA guidance documents on cold brew coffee could help to standardize regulation and production throughout the United States. The food regulatory system should continue to be developed towards a hazard analysis, systems-based approach. And here's the acknowledgements. Thank you to all who completed the survey, to Bruno Xavier and Ann Charles Vedgal of Cornell, to IFPTI staff, including all the mentors, the other fellows of Cohort 8. AFTO Program Director Patrick Kennelly helped me with a large list of 8 regulatory agencies, emails. Thank you to IFPTI's technical assistance with the PowerPoint. Thank you to New York State Ag and Markets for allowing me the time and support to complete this project. Thank you to FDA and Ag and Markets for training and resources, and to my wife and daughter for getting by without me for the few weeks I've been gone on this training and this project. And now I'll open it up to any questions.
Oh, thank you, Josh. And so we do have a lot of questions coming in. So let's get right to them. How about, has there been like a critical control point identified in preventive control or preventive controls for cold brew manufacturing?
Yes, that's a good question. So, I mean, I'm not conducting a hazard analysis. I don't have the guidance for industry right in front of me here now, but just from, I do have quite a few of these places around Brooklyn, and just off the top of my head, I'd be looking for mycotoxin control at receiving, certificates of analysis with each shipment. They would have to have a sanitation preventative control after the roasting. The concern being Listeria monocytogenes contamination. The roasting step, I believe, would probably be excessively, considered a very lethal step, like 500 degrees. I wouldn't worry about that as a process preventative control. But then also refrigerated storage for the finished product, a process preventative control, things like that. And you'd want to have process preventive control for the, the steeping and nitrogen filling, all that type of thing. So there's a lot of concerns that have to be addressed.
Okay. Well, and you mentioned cleaning and sanitizing unique equipment, and that was a challenge. Can you elaborate on that a little bit?
I mean, wholesale, we would just, have to be adequate. They'd have to have verification that it was working. Again, Listeria monocytogenes would be the concern. It could survive in the finished product, and based on the science that we have now, it would be of concern. So, retail, same thing, except it would just be under the food code, but we'd want to make sure that it was rigorous, that there was a sanitation step, effective sanitation step, things like that.
Okay, good. All right, another question coming in. Is there any finished product sampling for possible pathogen identification currently being done by regulatory agencies in the U.S.?
That's another good question. I have not personally sampled any cold brew for pathogens. There's so many things to sample for out there. Maybe, but might not be a bad idea at some point, especially considering a lot of these places I inspect don't have any food safety documentation yet, a lot of them. They're working on it. I don't know about other agencies. I didn't really ask that question around to other. It'd be a good question to follow up, a follow-up study to call around or email and ask if anybody's done any testing. I'm sure academia is doing some other challenge studies. I think there's some other challenge studies in the works where they're doing inoculations and things like that. Okay.
Someone asked Josh if you know the purpose of nitrogen. You showed a slide of the nitrogen being added. Do you know what the purpose for that was?
Oh, yes. If you haven't had a nitrogen cold brew before, I encourage you to go out and try one. It's a little bit different taste. It gives a little bit of a effervescence, a little bubbly, kind of almost a foamy taste. A lot of people like it. It's pretty popular. I think they have them all over now. Starbucks has drafts, cold brew, other places, Dunkin' Donuts. You can get it anywhere now at the retail grocery store.
Okay. Josh, there's a lot of questions coming in about foodborne illness. And so in your research and in discussions with states, any reports of foodborne illness from cold brew coffee?
Yes, I didn't ask that question, but to my knowledge, that's another good follow-up question. But to my knowledge, I don't think there have been any outbreaks tied back to it. Possibly there might have been some illnesses that didn't get attributed to it. Based on the science, though, like I said, these things are going to have to be controlled. It would be a shame if there was an illness resulting from some poor sanitation or some problem with any of these products. So that's why we have to prevent that.
Okay. Okay, yeah, I see a lot of questions on outbreaks, and let's see, how about, there's another question about illness. A lot of people want to know about illnesses, and I think if you can elaborate again, I think your research was showing that the potential is there. There's been studies showing the survival of El Mono, and so I think as you pointed out in your research, you want to bring it to the regulators' attention that it could be an issue. How about a question? So we've got survival of LM. I think you covered that. Water activity, pH and water activity of cold brew versus hot brew. Josh, is that you want to elaborate a little on that anymore?
Yes, coffee's pH can vary, but sometimes around pH of 5. It's people often think that coffee is super acidic. I've heard that a lot from the industry and from other people, and it's not as acidic as people think. It's kind of a low acid food. Tying back to the Listeria too, just to drive that home, very few cells of Listeria monocytogenes are needed to create an infection, especially in vulnerable populations. So that's why it's of such concern. I believe that's why Cornell decided that was their target organism for this product.
Okay. Here's a question about, are you aware of any corrections that regulatory agencies have required of operators or any other types of regulatory actions?
I didn't ask that question nationally, but I could just speak from my own experience. Yes, I mean, these places that I inspect, they're going to have validation. They're going to have process reviews from food scientists, working with Cornell and other process authorities, whoever they can, to verify that their production processes are safe, based on all these hazards that we've determined.
Okay. And kind of a question someone is asking is about the large manufacturers who are in the coffee business, like Starbucks and places like that, and smaller places that you identified. They want to know about, do the big players have systems and processes in place, and is it really just a problem with the firms?
I can't really speak from experience on most of the big companies, but I imagine they have preventative controls, food safety plans, and validation studies. Yes, it is really more, maybe some of the facilities who are able to be, the qualified facilities, the medium-sized companies, the startups, the newer ones, could be more where the issue is with having to make sure they get these validations and get the food safety documentation in place.
Got it. Okay. Well, I think at this point we are at our time, Josh, for questions. So we want to thank you for a great presentation. And again, hopefully you'll see Josh's email address over in the Q&A box or the chat box. It's one of those places because I just saw it. And so if you have additional questions, or if we didn't get to one of your questions, please feel free to send an email to Josh, and I'm sure he will have a discussion with you on that. So good. Well, at this point, I think we are at the close of this week's session. We want to thank you all for attending. As a reminder, AFTA will post these webinars on its website, and you can find them as well on the IFPTI website. And you'll also be able to find the posters and full research papers on IFPTI's website as we post those after each of these webinars. I'd like to thank Summer and Josh and Laura this week for their presentations. I hope you all can join us again in next week for more presentations, and then again the week after that. Remember, you have to register separately for each of these sessions. So just because you registered today doesn't mean you'll get an email about next week. So go ahead Go to the AFTO e-news and you'll see that come out every week, and you can register for next week's session as well. And until then, we'll see you, and thank you all for attending today. Have a nice afternoon.